Governor Newsom still expects the state to hit its peak sometime in May. Good evening, everyone, and thanks so much for joining us. I'm Elizabeth Kling.
And I'm Tony Lopez. The governor says the state should have enough beds and doctors by then to handle the so-called surge. Now, work is commencing around the clock at Sleep Train Arena in Natomas. The governor says it should be ready to accept patients by April 20th. Just 2 weeks from today, so they're moving quickly on this. It will handle both coronavirus patients, we're told, and regular trauma care patients as well.
And there's a growing response to help treat patients in California. More than 81,000 nurses and healthcare providers have submitted applications for the state's new health corps less than a week after it launched.
Let's dive into that. Tonight, there are still questions about how that health corps will operate and how much it's going to cost and whether taxpayers are footing the bill.
CBS 13's Marissa Perlman is live at Sleep Train Arena getting answers for us. Marissa.
Well, guys, we are told it is like recruiting for the military. We're told by April 20th we could see patients being treated here, but now the question is when and who will be showing up to treat them.
They're looking for how recently, apparently, have you worked as a nurse?
Mary Carol Todd, a retired nurse, speaks with us, waiting to hear whether she'll be deployed as part of the California Health Corps.
It doesn't appear that their resources are being strained to the point that they need additional people to help yet.
She's one of 81,000 retired health professionals who want to fight this virus on the front lines, but she's not needed yet.
It says there are no messages, and then there's this thing called Pulse, and apparently there's a big red button at the top that says don't push until you're deployed.
State leaders haven't said how much volunteers will be paid or how quickly they'll be assigned or how long. Now the state's task is to bring this volunteer army into the existing healthcare system and staff the medical facilities springing up like Sleep Train Arena, a site which has been sitting empty for years. The arena will now provide up to 400 beds for patients with mild to moderate symptoms. Now the staff assigned to work here will wait.
A lot of folks filled out forms and they already have existing jobs within the healthcare delivery system. So we're weeding those numbers out and we are triaging multiple things. There's geographic triage, meaning where are you physically and where are the needs most, and see if those match.
Today, the governor said he has more than 4,600 beds locked in across the state. He couldn't say if there's a budget, but says much of the cost will eventually be reimbursed by the federal government.
We have the capacity within the existing funding systems, be it the Medi-Cal system, other systems of support, including our own contribution.
So still a lot of questions about how this will be coming together, guys. There's also little information on how the state will protect itself from legal liability. A lot of questions from those medical staff stepping up to join this program. The governor says, once again, this is the spot where we could see patients here as early as April 20th.